Acute myeloid leukemia is a type of leukemia, a cancer of the white blood cells. Your child's body needs white blood cells to help fight infection. There are two different types of white blood cell: lymphoid cells, also known as lymphocytes, and myeloid cells. Normally, these cells repair and reproduce themselves in an orderly and controlled way. In leukemia, however, the process gets out of control and the cells continue to divide but don't mature. Acute myeloid leukemia is often called AML, and it's an overproduction of immature myeloid cells called myeloid blasts or blast cells. Immature myeloid cells fill up the bone marrow and stop it making healthy blood cells. As these cells are immature, they cannot work properly. This puts you at an increased risk of infection. Symptoms of acute myeloid leukemia, such as bruising and anemia, are caused by the bone marrow's inability to make enough healthy red blood cells and platelets. There are different subtypes of AML. The subtypes of AML are classified according to exactly which type of cell is affected, the stage of development of that cell, and whether the cells are differentiated. Knowing the subtype of AML is important, as it helps doctors to decide on the best treatment. Childhood leukemia develops quickly. The symptoms of acute myeloid leukemia are quite general, including pallor and tiredness. This is a result of anemia, unusual bleeding and bruising, frequent persistent infections, and breathlessness. A diagnosis of childhood leukemia is usually made on the basis of a blood test. This test will reveal low numbers of normal white blood cells and large numbers of the abnormal leukemia blood cells. Once this has happened and the doctors have the results, you'll be referred to hospital for further tests. A sample of bone marrow will be taken to confirm the exact diagnosis, and often a lumbar puncture is performed at the same time. The treatment for acute myeloid leukemia, or AML, is shorter and more intensive than for acute lymphoblastic leukemia, or ALL. The total duration of treatment for AML is around 6 months, and children will usually be admitted to hospital for the full duration of their treatment. This is because the intensive treatment can make children very unwell, and they need a high level of supportive care. The main AML treatment is chemotherapy. A combination of chemotherapy drugs is given according to a treatment plan, and this is also called a protocol or regimen. The treatments used in childhood leukemia often cause side effects. Most side effects are temporary and can be minimized with good supportive care. The most common short-term side effects include nausea and vomiting, hair loss, reduced resistance to infection, bruising and bleeding, tiredness, and gut and nutritional symptoms. A number of children may develop persistent side effects as a result of treatment, sometimes many years later. These are known as late effects. These can include a reduction in normal bone growth, reduced fertility, a change in heart function, and a small increased risk of developing a second cancer later in life. Until the 1960s, childhood leukemia was incurable. Today, thanks to improvements in care and sustained investment in research, the outlook for young patients diagnosed with AML has dramatically improved. A high proportion of children with AML will achieve remission, but up to a quarter of these children will relapse and their disease will return. Relapse usually occurs within the first 3 years after treatment. Although relapse AML tends to be more resistant to treatment, Many children can be successfully retreated. The significant factor in relapse is timing. Children who relapse a long time after treatment has finished have a better chance of responding to retreatment. These children will be considered for a stem cell transplant if they've not already had one. In children who have already received a transplant, it may be possible to use immune cells from the original donor to treat a relapse. This is known as donor lymphocyte infusion. The likelihood of a relapse progressively decreases with time, although late relapses do occur.